All right, hello. So this is my orofacial examination. This is my sister Jasmine. She is 17 years old. She'll be a senior this year. Okay, Jasmine, so today we're going to look at different sections of your face. It'll be an orofacial examination. So the first section that we're going to start off with is the structure and function of your facial muscles, okay? So just by looking at you here, I'm looking at your mouth. I don't see any drooping in the corner of your mouth, so that's good. Your eyelids, they're very proportionate. There's no partial or one eye partially closed or completely closed. Your mandible and jaw, let's see your mandible and jaw. Okay, yep, that's good. It's not drooping from one side more than the other. No abnormal movements. I don't see any facial grimaces or spasms, twitching, and there are no signs of mouth breathing or drooling. Okay? All right, Jasmine, I'm going to ask you to give me a big smile, beautiful smile. Okay, the mouth is proportionate. There's no deviated side. Now I want you to open your mouth really wide. Go, ah, good job. Okay, the jaw deviates on both sides. Go ahead and close. Okay, now Jasmine, can you raise both of your eyebrows? One more time. Okay, now close your eyes really tightly. All right, good job. So with your eyebrows do rise evenly, and when you close your eyes, they both close at the same time evenly. Good job. All right, moving on to the next section is the structure and function of your lips, okay? So, once again, there appears no drooping of the mouth. There is an adequate amount of tissue on the lips, big, beautiful lips. The lips do remain closed, while at rest. There are no signs of mouth breathing or drooling. The lip tissue does appear healthy. Nice color too. And there is no evidence of a repaired cleft lip or other scar tissues, okay? All right, Jasmine, can you give me one more time a big smile? Beautiful. Okay, lips, they deviate at the same time, or there's no one side that deviates than the other. Okay, now go ahead and pucker your lips. Pucker, go like this. Okay, the lip puckering is good. Now what I want you to do is I want you to pucker and smile. Just like that, go ahead. Okay, the range of motion appear adequate for speech. Okay, Jasmine, now I want you to puff your cheeks and hold the air in your cheeks, okay, for 5 seconds. I'll count it for you, okay? I'm going to put this mirror right under you to see if there's any fogging. Go ahead. 5, 4, 3, 2, and 1. Good job. There's no fogging. Okay. Now you're going to repeat after me. You're going to go O, E, O, E, O, E. Go ahead.
O, E, O, E, O, E.
Good job. So the range of motion and strength of the lips seem appropriate. Okay, now let's look at the structure and function of the tongue, okay? Go ahead and extend your tongue out. Just stick it out. Okay, the tongue does appear normal. The size of the tongue appear appropriate in relation to the child's oral cavity. Let's see. Good job. There are no signs of atrophy, which is a muscle loss. Go ahead and put your tongue back in. And no abnormal movements, no spasms or twitches, okay? All right, now you're going to protrude your tongue out. So what that means is you're going to extend your tongue out just like that, okay? Okay, go ahead. All right. Okay, so you did that activity without any effort. Go ahead and put it back in. Now I want you to stick your tongue out, in and out, okay? In, out, in, out. Go ahead. In, out. Good job. All right, so the speed and the range of motion appear appropriate. The tongue does not deviate to one side, okay? All right. Now, you're going to extend your tongue out one more time, and this time I'm going to count to 5, all right? Go ahead, extend your tongue out, protrude. 5, 4, 3, 2, and 1. Good job. So you did this without resting the tongue on the lower lip, and the tongue does not rest on the lower lip, okay? So now, while your tongue is protruded, I'll ask you to do that one more time. I'm going to ask you to move the tip up, down, side, right, left, and then side to side, okay? So just like this. Okay? All right, go ahead. Up, down, side. Good job. One more time. All right, now do it as fast as you can. Up, down, side, side. Up, down, right, left, side, side. Good job. Good job, Jasmine. All right, the range and motion of excretions are appropriate. No signs of groping, uncoordinated movement, or weakness. Okay, now I'm going to ask you to retract your tongue. So you're going to pull your tongue back. Good job. So the speed and the range of motion appear accurate and adequate. Go ahead and lift your tongue one more time to see the lingual frenulum. Good job. There's no tongue tie and ankyloglossia. Good job. All right, now you're going to repeat after me. You're going to go ka 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 ka.
Ka 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 ka.
Good job. Motion, strength, and excursion of the tongue seem appropriate. Now go ka 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 la.
Ka 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 la.
Good job. The range of motion, strength, and excursion of the tongue seem appropriate. Structure of the hard palate. Now I'm going to bring my mirror in just so I can observe your hard palate, okay? Check it. Go ahead and open your mouth. Okay, the coloration of the hard palate appear normal along the midline. Let's see, the width and the height of the hard palate appear within the normal range of speech production. Okay, go ahead and close. Give you a little bit of a rest. I did check and see if there are any signs of repaired or unrepaired clefts, fistulas, or fissures, and that doesn't appear like it. Go ahead and open. Okay, no signs of surgical removal of any portion of the hard palate, and there are no dentures, obturators, and palatal lifts, excuse me. All right, now we're going to check your soft palate, okay? Go ahead and open. Okay, go ahead and close. So the coloration of the soft palate appear normal along the midline. So it is a white and a pink. Good job. All right, there is no uvula bifid. No signs of repaired or unrepaired clefts, fistulas, go ahead and open, or fissures. Okay, no signs of surgical removal of any portion of the soft palate, no dentures. The velum does appear symmetrical. We'll go ahead and check one more time. Okay, symmetrical velum. Go ahead and stick your tongue out with that. Good job. Okay, and the length of the velum does appear sufficient for adequate posterior movement in the velopharyngeal closure. All right, Jasmine, so you're on your summer break. Have you done anything fun? What have you been doing for the summer?
I've been trying to stay active by doing a lot of workouts and just trying to eat healthy as well.
Okay, good job. Have you worked out outside or anything?
No, it's way too hot.
It is way too hot. Yes, I agree. Okay, so your speech sound is not hypernasal or hyponasal. The pressure of consonant are produced correctly. There's no unusual substitutions such as pharyngeal fricatives or glottal stops for pressure consonants. Okay, now I'm going to ask you to produce a prolonged ah. So you're going to go ah. Okay, and then I'm going to look in your mouth. Go ahead. Ah. Good job. The velum does move up and back to meet the pharyngeal wall. Now this time you're going to go ah 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 ah. Okay, go ahead. Ah 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 ah. Okay, the velum does move up and back to meet the pharyngeal wall. Okay. Now, Jasmine, I'm going to ask you to say some words, all right? Okay, I'm going to put this right here. So you're going to say run.
Run.
Pat.
Pat.
Wet.
Wet.
Sit.
Sit.
She.
She.
Okay, again.
Run.
Pat.
Wet.
Sit.
Sit.
She. Good job. Okay, so there's a little bit of mirror fogging, and that is okay. All right, now teeth and related structures. Now we're going to look at your teeth, okay? I'm going to ask you to open your mouth one more time. I'm going to check if there's any missing teeth, teeth jumbled, tilted, or malpositioned, any full or partial dentures in place, any dental appliances such as braces. Okay, go ahead and open. Okay, so no missing teeth, no jumbled, tilted, or malpositioned, no partial dentures, and no braces because Jasmine just got her braces taken out. Okay, not too long ago. Okay, go ahead and bite down gently and separate the lips so the teeth can be observed. So you're gonna go like this. Good job. Great job. Okay, so it is normal occlusion. So I do see, go ahead, bite down. The lower first molar is approximately half tooth ahead of your upper molar. All right, so there is no neutral occlusion, which that means your upper and lower dental arches are normal inclusion. No individual teeth are misaligned, rotated, or jumbled. Go ahead, keep going. Right. Okay, good job. No distal occlusion. Lower dental arch is not too far back in relation with the upper dental arch. Okay, and go ahead. Let me check your chin. Yep, chin. Good job. So I see that your chin is fine. So there's no receding chin. So there's no overbite. Excuse me. Let's look at the mesial occlusion. Go ahead, Alvin. Yep, there's no underbite. Beautiful smile. Okay. Let's check for open bite, lack of contact between your upper and lower front teeth. Go ahead. Okay, central space is created. There's no central space created here, no central space. Okay, let's look at overjet. Excessive horizontal distance between the surface. Go ahead. Normal distance. Okay, 1 meters. Okay, so normal distance would be 1 to 3 millimeters of the upper and central incisors. In relation to the lower central incisors can be expected. Good job. That is fine. Now closed bite, go like this. Okay, excessive vertical overlapping of the upper front teeth over the lower front teeth. The upper front teeth cover more than the usual half of 1/3 of the lower teeth. Inclusion of the molars are normal. Okay, good job. Cross bite, lateral overlapping, one more time. Okay, each time go like this. Good job. Okay, so lateral overlapping of the upper and lower dental arches. The lower jaw is either to the right or to the left of a normal central position in relation to the upper jaw. So good job, that's a yes. All right, now I'm going to ask you to repeat these really quickly and you'll have just 5 seconds. Okay, so you're going to say pa 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 pa, and you're going to say that 5 times in 5 seconds. Ready? Go ahead.
Pa 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 pa. Pa 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 pa.
Good job. Okay. All right, now you're going to do the same thing for 5 seconds. You're going to go 2, 2, 2, 2, 2, 2, 2, okay? Okay, until the 5 seconds are done. Go ahead. Good job, good job. Okay. All right, now go ahead. Good job. Okay. Now you're going to say foo 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 foo. Ready? Good job. Okay, ready now. Loo, 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 loo. Good job. Last one. Poo, 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 poo. Ready? Go ahead. Good job. All right, awesome job. All right, Jasmine. Okay, thank you so much, Jasmine, for all of your hard work. Your checkup is complete. Thank you.